Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Payne with the Ask Dr. Payne weekly segment. And Dr. Payne, we have a question here on a brow lift. This person has a question pertaining to or having a delicate brow lift done. Will Botox, derma fillers, or maybe something else work? The person's about 25 years old. Their eyebrows are situated really low on their forehead, and it makes them seem like they're angry all the time. So she's interested in what can she do for a gentle lift. Not too much, just enough to lift them from their eyelids. Apparently, surgery is too expensive, and personally, they think it's a little too invasive. So, Dr. Payne, what options does she have, and what do you suggest in this case?
Well, it's a real good question. We're seeing more and more people that are on the younger side who look to do things, and maybe that's just because it's more business and what can be done are more prominent and available than it was maybe 15 or 20 years ago. There's a lot of sharing of images on social media and so forth. Take a step back. We're talking about somebody that's 25 years old, and I'm glad that they thought the surgery is too expensive and too invasive. Depending on where you are in the country and what you're looking to do, there will be people that are going to recommend things that are more invasive. I don't agree with that in somebody in this age group, talking 25. So the person is basically just reaching that peak, where they're never going to look as young as they are. And essentially, it's well before the typical age that we do surgical things, either with brow lift or eyelids or something like that. So I think that's good. But the way the world works, and especially if you're in a place like Florida, somebody's probably going to recommend it. So I would advise the person to take a step back if they should get such a recommendation. Even the injectables, people will have mixed opinions on. But in this case, you've got a good reason for doing what they call a chemical brow lift with Botox or Xeomin or Dysport. They're all equivalent, more or less, in terms of how they work. The way it works is, if we have our little face picture here, we've got in the upper third that counteract different and pull in different ways. And by using the neuromodulator or the Xeomin, Botox, whatever, that's the fancy term for it, you can block some of those muscles, and then the other muscles will pull. It's almost like two people on a tug of war, for example. So if you weaken one side, you're going to get more of a pull in the other direction. Doing that well requires a little bit of finesse, but most plastic surgeons that inject a lot and most dermatologists that inject a lot are very good at it. So you can take the corner of the brow up, you can make the center part come up a little bit, the whole thing can come up a little bit, depending on where you put the dosing. Somebody that's 25 is not going to have a lot of wrinkles elsewhere. Trickier issue. Some people like to put fillers out near the edge of the brow. I think it gives a little bit of a weaker result than the neuromodulators. And in somebody young with a filler, you're only going to need a little bit. Where are they going to put the rest? The only place age is going to be in the lips, and they may not be interested in that. So to get the final recommendation, you have to have an in-person consult. But those are the over group of 25. Surgery should be out in almost all cases unless there's something really unusual. And the neuromodulator is a good way to go. It's got to be repeated a couple times per year because it doesn't last forever. Roughly, depending on exactly what is done, but it can enhance things, and it's not very invasive. And in terms of the cost too, sometimes even the financing in offices, including ours, low payments and so forth. We don't like people to use a lot of financing for injectables, the bigger procedures, but it's still an option. And some of them even have low interest or no interest plans for people that are interested in going that route. Hopefully that will cover it, and we'll see you on the next question.
Well, thank you, Dr. Payne. We appreciate your time. And if you have a question for Dr. Payne, please visit our website or Facebook page. And we appreciate your time, Dr. Payne. We'll see you on the next one.
Great.